Hi everyone. My topic for today is Crohn's disease. What is Crohn's disease? It's a type of inflammatory bowel disease or IBD. It is a lifelong condition that causes part of your digestive system, also known as digestive tract. With Crohn's disease, the inflammation can go right through the entire thickness of the intestinal wall. Crohn's disease can affect any part of the GI tract, including mouth, esophagus, stomach, small intestines, large intestines, which include the colon, and the rectum or anus. Crohn's disease is a chronic medical condition which requires surgery when medical treatment fails. It isn't clear what causes Crohn's disease. However, the following factors may influence where you get it: your immune system, your genes, and also your environment. The symptoms of Crohn's disease often develops gradually. Certain symptoms may also become worse over time. The earliest symptoms of Crohn's disease can include diarrhea, abdominal pain, weight loss, bloating, blood in the stool, fatigue, and also loss of appetite. The symptoms may become more severe as the disease progresses. More troublesome symptoms may include perineal fistula, which causes pain and drainage near the anus. Ulcers that may occur anywhere from the mouth to anus. Inflammation of the joints and skin. And also shortness of breath. We have 5 different types of Crohn's disease. Number 1, ileal colitis is the most common form of Crohn's disease. Inflammation and irritation of the ileum and the colon. Number 2, gastroduodenal Crohn's disease affects the stomach and the first part of the small intestine. Ileitis is an inflammation of the ileum, a portion of the small intestine, and fistulas may develop. Number 4, Crohn's colitis is characterized by inflammation in some or all of the colon. It can cause fistulas, ulcers, and abscess to form around the anus. Number 5, jejunulitis causes inflammation in the middle part of the small intestine and the ileum. According to the statistics, in 2015, an estimated 3.1 million adults in the United States had received a diagnosis of IBD. And according to the Crohn's and Colitis Foundation, Crohn's disease may affect as many as 780,000 Americans. In 2018, approximately 217,000 was reported with IBD. People with Crohn's disease have elevated risk of premature death. We have 47% higher. In 2008, physician visits were estimated to cost the Canadian healthcare system $80 million per year for Crohn's disease. In 2012, total indirect costs for Crohn's disease were estimated to be $869 million. And Canada has among the highest reported prevalence and incidence rates of IBD in the world. The diagnosis for Crohn's disease: your doctor will likely use a combination of tests to help confirm a diagnosis of Crohn's disease, including lab tests. Blood tests can help the doctor look for the problems such as anemia and inflammation. And we have stool tests. It helped the doctor detect blood in our GI tract. Lastly, colonoscopy to examine the large bowel. And also we have imaging, imaging tests. Number one, X-ray, MRI, and CT scan. Crohn's disease treatment. There's no one best treatment for Crohn's disease. The goal of treatment is to decrease the inflammation in your intestine, to prevent flare-ups of the symptoms, and to keep you in your remission. Another goal is to improve long-term prognosis by limiting complications such as abscess, fistulas, malnourishment, fissures, and strictures. Treatment and medication. About 66% to 75% people with Crohn's disease will need surgery. It can help with complications such as bowel obstructions, abscess, fistulas, malnourishment, colon cancer, and sepsis. However, surgery does not cure Crohn's disease. We have fistula removal. Closes, opens, removes, or drains a fistula that doesn't heal with medication. And number two, strictureplasty is a technique used to widen a narrowed intestinal passage. Abscess drainage. Your surgeon cuts into an infection in your belly, pelvis, and around your anus and puts in a tube to drain pus. And eleutostomy. This kind of prostulectomy reroutes the end of your small intestine through a small hole in your belly called stomata. Colectomy involves the removal of a diseased portion of the colon. Bowel resection removes part of your small or large intestines that been damaged by Crohn's and connects the two healthy ends. And lastly, brutulectomy involves the removal of both the colon and the rectum. According to the study, approximately 30% of patients who have surgery experience reoccurrence of their symptoms within 3 years, and up to 60% will have reoccurrence within 10 years. We have to change our lifestyles even when your Crohn's disease is in a period of remissions. It is important to know how to manage it so you can avoid severe flare-ups and prevent lasting damage to your digestive tract. You should maintain a healthy lifestyle. Make sure you get enough sleep, exercise, get balanced diet, and most especially, don't smoke. And that ends off my topic. Thank you.